Dr. Bob Lahita joins us now. He's the director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Dr. Lahita, always great to have you. And one of the many reasons that we love having you is because we know you are a straight shooter. You're going to tell us what we need to know, but you're also going to help us just understand it and help us kind of wade through all this. And this one is a debate. I mean, people are, of course, tired of wearing masks, but people know that they're keeping us safe. But then when we think about the fact that we're outside and we've always known that that's where we're safer, I understand why people are wondering what's going on here. We also know that much of the guidance that we've been receiving has started quite conservatively while we learn more. So tell us, what rules here make sense to you?
Well, Savannah, you hit on a very good point. You know, if I look at the map of the United States, which is color-coded by those states who allow people to drop their masks completely versus those that make us wear our masks, you'll note that in the Northeast and the West, we're mandated to wear masks at all times. But in the South, like Texas, Arizona, Florida, have dropped the mask completely. I'm expecting the president to use the common sense that Dr. Fauci brought up, and that is that when you're outside, you shouldn't have to wear the mask, particularly if you're vaccinated. It simply means that airflow is so good that the chances of infection are probably minuscule. And we've always thought that. And that's why people go to restaurants and they eat outside. And the air, you know, has got to be flowing. If you're indoors in a restaurant and you're vaccinated, you shouldn't have to wear a mask if you've got good ventilation. And the key here is vaccination. Many people, you know, Savannah, just don't want to get vaccinated, like 20% of the population. And I'm very dismayed by the group, the several million people who have not had their second shot yet, because that's a roll of the dice. You know, we want you to have that booster shot. There's a reason for the second shot. And if you don't get it, you may not be fully vaccinated.
So, Dr. Bob, let's pick it up right there, because I think part of the issue here is maybe you know if you're vaccinated, and if you're outside and you take your mask off, you have this knowledge that we hope that we are safe, we have some immunity. But of course, you don't know about those people around you. And we do know, like you just said, about this hesitancy issue. So we're so used to wearing masks everywhere we go, inside, outside. If we're fully vaccinated and you take your mask off outdoors, what does it mean both for you, but also for those around us? What's the science here on what's safe?
Well, it's safe because you're not going to transmit the virus and you're not going to get sick from getting the virus from someone else. But if you're around people who may not be vaccinated, it would be prudent for you to continue to wear the mask and keep your social distancing. If you're with your friends and you're jogging in a group where you have all been vaccinated, there's no need to wear a mask. If you're in your house with your family members who have all been vaccinated, except for little children who don't need to be vaccinated right now, you're fine without wearing a mask and just carrying on with your normal lives. So I think the president's going to make it very clear that this is based on science and the CDC works with data. And that's what's most important, Savannah.
So, Dr. Lahita, you just mentioned an example of being indoors, still with that family unit, and if you're all vaccinated. But where does the vaccine rollout need to be in order to lift an indoor mask mandate in general? Quickly, when do you think that could be possible?
Oh, boy. Well, that's a tough one. I think when we so far have, as you mentioned, 28.5% of the population. We want to get to herd immunity, and I say that often, and that's between 70 to 80% of the population either being vaccinated or having been infected. Once we get to herd immunity, we can all drop our mask and live our lives normally like we did in the past. But that is a wish, and that is not a reality at this time.
Dr. Lahita, I don't love when you start an answer with, oh, boy, but we do love always having you. Thank you so much. See you soon.
Thanks, Savannah.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.